Hi, today I'm here with Dr. Deborah Beidel, Professor of Psychology at the University of Central Florida. And today we're going to be talking about anxiety disorders. Thank you very much for being here today.
Thank you for inviting me. It's a pleasure to be here.
So my first question is that some parents, if they're worried about their child being overly anxious, how can they tell if their child actually has an anxiety disorder?
Well, there's a couple things that we ask parents to keep in mind when we're talking about whether or not a child has an anxiety disorder. One is to look at the level of distress that a child might have. So, for example, if a child seems to go into a situation and they seem to be a little bit uncomfortable, but after about 5 or 10 minutes they calm down and they're having a good time and they're playing and they're laughing, that's not something that we as clinicians will worry about. So we talk about significant distress where children are crying, refusing to go to places and do things. The other is functional impairment, and that means, again, are they not doing things that kids should be doing? So are they not going to birthday parties? Are they avoiding school? Are they refusing to play on a baseball team even though they love baseball because their anxiety may be too severe? Another thing that we think about in children is really the developmental appropriateness of a fear. So it is normal for 3- and 4-year-olds to be afraid of dogs, to be scared when they hear a lawnmower. But we don't have that same expectation when children are 12 or 13 years old. And fear of the dark is a very good example. Lots of little kids are afraid of the dark, not many 12-year-olds. So if the fear is not developmentally appropriate, that's another sign that a child may have an anxiety disorder.
And what types of professionals in the community may help a parent go through this assessment procedure?
Well, there are different types of professionals. There are a number of pediatricians who have been trained. There are a number of clinical psychologists, psychiatrists who may have training, who are trained as child clinical psychologists, child psychiatrists, who may be able to help parents determine whether or not their fear is normal or abnormal in the child's particular case. Also, sometimes even school counselors may be helpful because they've seen a lot of children, and so they can help parents judge whether or not this fear is abnormal.
So what kinds of treatments are available for anxiety disorders that have good scientific evidence?
Well, there's two classes that we really think about when we think about treatments that have scientific evidence. One are the cognitive behavioral or behavioral treatments, and the most common treatment is something that we call exposure therapy. So that's the most common treatment for anxiety disorders from a psychological perspective. From a pharmacological or medication perspective, we talk primarily about a class of drugs that we call SSRIs for short, or selective serotonin reuptake inhibitors. They're sometimes called antidepressants, but they work in anxiety disorders as well. So among the medication group, that class of drugs would be the ones for which there is some scientific evidence that they help with anxiety disorders. But in the psychological side, it's exposure therapy.
So how would a parent know if their child is actually getting cognitive behavioral therapy or exposure therapy?
Well, that's a good question. The parent would want to see that the child is being encouraged to face their fears. So the example I usually give is if we say to a parent, how do you get over your fear of a dog? Well, you've got to be around a dog. So if you're afraid of something, you have to be in contact with that object or situation, whatever it might be. And so exposure therapy involves just that, putting the person in contact with what it is that frightens them and helping them overcome their fear.
So you mentioned that CBT, exposure, and SSRIs are treatments that have good scientific evidence for anxiety disorders. But as we know, there are many different types of anxiety disorders. Are there special treatments for specific anxiety disorders?
Well, in addition to exposure, one thing that we know might be important for children who have social phobia or what is social anxiety disorder is social skills training. In those situations, we often know of children who, because they've always been fearful around people and around other children, have never learned how to appropriately interact. So for many children with social phobia or social anxiety disorder, because it goes by both names right now, now, we recommend adding social skills training to exposure therapy.
And what would social skills training look like?
Social skills training is actually a procedure where we teach children exactly what it is that most of us learn naturally. So we may teach them how to practice saying hello to other people, how to make eye contact, how to talk in a loud enough tone of voice, and working up from very simple skills to more complex skills like giving compliments, receiving compliments, inviting someone over to your house to play.
So what might be a parent's role in treatment?
Parents have very important roles in treatment because, first of all, children don't usually come to treatment by themselves. So parents have to bring their child to treatment. But for all of the psychological treatments, exposure therapy, social skills training, parents play a very important role because not all of the treatment goes on within the 1-hour therapy session. Children are given homework assignments to either practice the exposure, practice the skills outside of the clinical setting, and parents have the responsibility of taking the child to wherever they may need to go and to helping the child do their homework. Parents are also responsible for giving very cool reinforcers or prizes after the completion of the task that children are asked to do as a way of showing reward, as a way of showing the children that they've done a great job and they've earned something special for facing their fear. The most important thing that parents can do is reward children for facing their fears. It's not always that the task has to be ultimately and completely successful. We want parents to reinforce their children for being brave. If they reinforce them for being brave, they will then be successful.
So if a child has an anxiety disorder, how might that affect them as they get older, into adolescence, or even into adulthood?
Well, it could affect them in a number of different ways. And in some cases, it depends on the specific disorder. But in general, we know that anxiety disorders can create impairment in several different areas. It can affect academic functioning because if you're afraid to go to school, whether it's because you're afraid of germs or afraid of having to talk to somebody or you're afraid to be away from your parents, if you're not in school, you're not learning. Okay? You're also not being around other children. So it can definitely affect academic functioning. And if you're really uncomfortable around people or you're afraid that something might happen, you might decide not to go to college, for example, because it's just 4 more years of having to be around people. It can also affect occupational functioning. So for many people, they don't choose the career that they really want. They choose the career they can do because of their fears. So in the case of social phobia, for example, many people choose careers where they have to work in isolation or they're allowed to work in isolation because it limits their need to interact with other people. It can also affect general social functioning. People with anxiety are often uncomfortable in crowds, uncomfortable around other people, and they isolate themselves because of their fears.
So some parents might wonder, what caused my child to have an anxiety disorder? What do you usually tell them?
I usually tell them that if I knew the answer to that, I would probably win the Nobel Prize because we don't know the answer. We have several ideas. One is that there probably is some type of genetic component for some types of anxiety disorders. We say that anxiety runs in families, but we don't know, and we have not yet identified a specific anxiety disorder gene. What we know is that some people temperamentally just seem to react more to a situation. So you and I are sitting here, a loud noise could happen. If I'm temperamentally predisposed to respond anxiously, I might jump when that noise occurs. You might just sit there and go, I wonder why she's jumping. It was just a loud noise. But we also know that children learn things, as we all learn things. And so it's very likely that lots of times the fears we see in families can be as a result of children learning to be anxious because their parents are anxious about something. We often hear parents say, oh, I'm afraid of that too, but my child doesn't know it. And when we ask the child, is anybody else in your family afraid of this? They go, oh yeah, my mom's afraid of that too. So often parents don't hide their fears as well as they think they might. There's another way that anxiety disorders can develop, and that's what we call a conditioning experience. So it's very likely that someone may have a traumatic event occur, and after that time, they then may be anxious or scared around that situation. So, for example, if you get bitten by a dog, you may then develop a fear of dogs. Now, not everyone who's afraid of dogs has had a traumatic event, but it's possible that it could happen in that way as well.
Is there any other information that you think parents should really know about anxiety disorders?
Well, I think it's important for parents to understand, particularly in children, that sometimes fears are normal. And so you don't always want to react to the fact that your child has a fear, because at different developmental stages, children have fears that are typical and normal. So we want parents to understand that there is this developmental trajectory to fears, and that they need to always think about these things in context. Also, we need to understand that sometimes when traumatic events occur, children may behave differently for a little while. If that goes away, if they go back to the way they usually did, they just had a normal reaction to a fear.
Well, thank you very much for answering all of our questions.
Oh, well, thank you for inviting me to be here today.